So how would you know if somebody has cervical cancer? In a large majority of cases, in the early stages of the cancer does not cause any symptoms. By the time the symptoms are showing, this cervix has undergone a lot of change and will now look like that. That is cancer growing on the cervix. So by the time the symptoms will start, the cancer has already advanced. And the symptoms are very offensive vaginal discharge, bleeding during sex, or when you are washing yourself or your hand touches the cervix, it bleeds. We call it contact bleeding. Or the woman's menstrual flow becomes heavier than normal, or the woman is bleeding in between the menses. These will all be the symptoms when the cancer of the cervix begins to advance. We have said that virus which causes the cervical cancer is sexually transmitted. So women with multiple sexual partners, or women whose partners have multiple sexual partners, tend to be at higher risk. Women who smoke, women who do commercial sexual activity, women who engage in rampant, unprotected sex, high-risk sexual behavior, a woman who is diabetic and is not having a good control, a woman who has HIV and her immunity is low, are among, and some people who are using steroids. And so cervical cancer can be prevented by safe sexual practices, regular pap smear, so that we can detect the presence of that virus and then deal with that cancer before it becomes advanced and potentially fatal. Do your pap smear and avoid high-risk sexual behavior to keep away from cervical cancer.